Happy Thursday, everyone, and welcome to another educational video. My name is Hannah here from Preferred Physical Therapy, where we help people age 40 and above stay active and independent, live free from painkillers, and avoid surgery. So this week, I am talking to you guys about how your core weakness may or may not be affected in your low back pain. And I'm just going to start off with a disclaimer saying that your core weakness is not the sole answer as to why you're experiencing low back pain. Low back pain is complex and there are multiple pieces to the puzzle. And luckily, I have a puzzle right here. So the first piece may be your core weakness, okay? The second piece may be related to joint stiffness. Third piece may be more stiffness or tight hip and low back muscles. And the fourth piece may be from a movement dysfunction. It doesn't matter, but there are so many pieces to the puzzle as to why your low back may be bothering you. And a lot of times when people consider core or they hear, engage your core, tighten your core, they think of people that have six-pack abs. And having six-pack abs does not necessarily mean that you have a strong core. Now, your core is not only what you see in the front. It's not only the six-pack abs. It's comprised of multiple muscles along the front, the side, and the back. Your core is one big band that kind of wraps around your waist and goes all the way around. So you have your rectus abdominis, which are the six-pack abs. You have your obliques, which kind of run along the side of your body here across your rib cage, and they run in more of a diagonal position. Then you have your transverse abdominis, which is deeper in the abs and it helps to stabilize and engage your core. And you also have your lumbar spine muscles like your erector spinae and your multifidi. So when you're not properly engaging your core, you tend to find the stability and how you're positioned, whether it's sitting or standing, on different passive structures. And what that means is you're kind of hanging out on your ligaments. If you look at people, like I think back to elementary school when people were going through growth spurts and they were just growing way too tall, couldn't really control their bodies at that point yet. And they were kind of slouched forward around their shoulders, their hips were kind of sticking out in front, and they just looked like they were kind of hanging there. That is considered hanging on your ligaments and using passive structures. You kind of rely on the ligaments on the front side of your hip to keep you standing. And the tough part about that is that you're not engaging your core. You're not considering what your core is doing and how it may be affecting your back. Now, like I said, core weakness is not the sole reason as to why you're having low back pain. Core weakness stems from a variety of issues. And again, it may be stemming from the same puzzle pieces like I said earlier. So in having stiffness in the joints, in having tight muscles in the hips or the backs, in having movement dysfunction, you don't rely on your core as much. You rely on more passive structures. So the reason why strengthening your core is so important with low back pain is because it helps you find a better posture and a better position. So instead of hanging out on those ligaments, just kind of loosey-goosey, you're engaging that core. You're making that muscle memory to remind yourself to engage your core in standing up. And as women, we kind of naturally fall into a position where our low back sinks in. Our gut kind of sticks out, our bottom sticks out in the back, and we just kind of hang there and let our low back sink in. And that puts a lot of compression and pressure on your back. Like doing that, even in standing when I'm trying to show patients what it looks like, it's not comfortable. It's not comfortable. And if you're in that position for minutes, even hours, depending on what job or daily requirements that you have, it's going to cause low back pain. So you need to make sure that you are strengthening and stabilizing all of the core muscles. And I'm not just saying lay on the ground, do 20 sit-ups. That's not going to be good. You want to make sure that you're doing different static and dynamic exercises to engage all of the muscles on the core. That way they all can collectively help to create a better posture for you. I would suggest if you want to try out some different exercises, you can look online. Just make sure that you are listening to your body. But if you want to have more expert advice and more one-on-one time, you can always come into our clinic. We will be more than happy to help you with that, to help you reduce your back pain. You can also head on to our website where you can find more resources, more videos like this, different blogs, and even some Technique Tuesday videos like the one I had earlier this week, just with some easy exercises that you can maybe begin doing at home just to at least alleviate a little bit of your low back discomfort. But like I said, head over to our website if you're needing any other questions answered, or if you would like to get a hold of one of us. In this video too, you can also like, comment, and share it if you found it to be helpful. Also comment maybe some things that you have been doing at home as well. Just different things to engage the core, work on your posture, and it's not something that's just gonna come overnight. Trust me, we work with patients day in and day out throughout their entire plan of care to help them properly engage their core and find better postures and positions to help reduce their back pain. So, like I said, reach out to us if you have any concerns. Otherwise, I hope that you guys have a great rest of your Thursday and heading into the weekend, and head back onto our pages next week for another Technique Tuesday and educational video, but also a blog post as well. All right, have a great day.